Hello, and welcome to the Pharmacy Times News Network. I'm Brian Howe, president of Pharmacy Times, and your host for our Pharmacy Week in Review. Pharmacy Times traveled to Washington, D.C. this week to attend the National Community Pharmacists Association's annual convention. During the first general session, Joe Moose, co-owner of Moose Pharmacy, Pharmacy Times Advisory Board member, and past recipient of the Next Generation Pharmacist Award, was named the NCPA 2015 Independent Pharmacist of the Year. NCPA President John T. Scherer noted that Joe Moose is at the forefront of efforts to make independent community pharmacies an integral part of a more coordinated and efficient healthcare delivery system, which makes him a deserving recipient. Pharmacy Times also listened in on interactive sessions and interviewed panel speakers about topics that included controlled substance e-prescriptions, regulatory updates for drug compounding, and how to be prepared when the DEA comes knocking on your pharmacy door. Other highlights of the NCPA conference included opening statements from acclaimed TV journalist Candy Crowley and a keynote address from Freakonomics author Stephen Levitt. Moving on to policy news, a majority of the U.S. House of Representatives now supports the Pharmacy and Medically Underserved Areas Enhancement Act, otherwise known as Pharmacist Provider Status legislation. The legislative support of the federal bill is a milestone for pharmacists nationwide, though similar state-level initiatives have seen varying degrees of success. ASHP's Director of State Grassroots Advocacy and Political Action previously spoke with Pharmacy Times about how provider status as a policy agenda item is proceeding at the state level.
States deal with provider status in many different ways. Some states have a more robust collaborative practice agreement. Other states go through advanced credentialing like California did, and other states do it in many different ways. There are other states like North Dakota who has just expanded their collaborative practice agreement, so pharmacists can do more within the state.
Pharmacists can support the federal bill by visiting pharmacistprovidecare.com and clicking the Take Action button. In product news, Teva has launched a generic equivalent to Avodart in the United States. The company's dutasteride capsules are indicated to treat symptomatic benign prostatic hyperplasia in men with enlarged prostate to improve symptoms and reduce the risk of acute urinary retention and BPH-related surgery. The capsules are not approved for the treatment of prostate cancer. Turning to public health, did you know that 14% of undiagnosed HIV patients cause 33% of new infections? Fortunately, point-of-care HIV testing at retail pharmacies is poised to reduce these statistics. The tests take 20 minutes to complete in one pharmacy visit, which is much faster than the 2-week turnaround needed by established laboratories. New research indicates that an economy of scale exists for this point-of-care HIV testing because the cost of pharmacist training per patient decreases as the number of patients tested increases. When test results are positive, pharmacists can counsel patients and direct them to confirmatory testing to eliminate the possibility of false positive results. The CDC is applauding the accomplishments of pharmacists as the American Pharmacists Association nears the 20th anniversary of its pharmacy-based immunization delivery certificate training program. In a letter to all pharmacists, Assistant Surgeon General Dr. Ann Schuchat, the Principal Deputy Director of the CDC, recognized the important role that pharmacists play in reducing vaccine-preventable illness by improving patient access to vaccines. APHA Executive Vice President and CEO Thomas Menahan said the CDC's letter served as evidence that more patients are getting to know their pharmacist, echoing the theme of American Pharmacist Month. Pharmacy Times followers can generate goodwill for pharmacists throughout the month using the hashtag #ThankAPharmacist on social media. For more great coverage and practical information for today's pharmacist, visit our website and sign up for our daily e-news. And don't forget to follow us on Facebook, Twitter, and Instagram. Thanks for watching our Pharmacy Week in Review. I'm Brian Howe at the Pharmacy Times News Network.